Hepatic candidiasis is a disease that we typically see in those with immunocompromised history. I have not personally seen this, but it has a very distinct appearance to it. So remember to focus in on that distinct appearance and then recognize who is more at risk for developing this disease. So hepatic candidiasis is a fungal infection caused by yeast in the body that affects the organs. So we have yeast living all over our body. Typically our body can handle it, it kind of cleans itself, and we shower regularly, everything's fine. When your body becomes immunocompromised, it can no longer control the fungal population, and so your body just kind of gets taken over by it. So what we see is the fungal infection starting to affect the internal organs pretty severely. So I've already mentioned it a few times. We see hepatic candidiasis in immunocompromised patients. So those are going to be the patients with full-blown AIDS, possibly HIV. It's going to be more common. But we also see it in patients who have had chemotherapy or organ transplant because they have weakened immune systems. So I mentioned in the introduction that hepatic candidiasis has a very distinct appearance to it, and it does when it presents in its classic form. So you're going to learn two terms that go along with hepatic candidiasis. Make sure you know those for your boards. When hepatic candidiasis presents classically, what it's going to take on is either a bullseye appearance or a wheal within a wheal look on ultrasound. So these two terms are very commonly referred to when talking about hepatic candidiasis. Unfortunately, the lesions can also appear hypoechoic, so due to the variable appearance, hepatic candidiasis can really only be diagnosed by biopsy. But given the classic sign of bullseye or wheal within a wheal, history of AIDS or chemotherapy or organ transplant, there's a strong chance that this is going to be more hepatic candidiasis versus like hepatic mets. All right, so remember that hepatic candidiasis goes along with immunocompromised patients. Know what causes hepatic candidiasis, and then remember to correlate bullseye pattern or wheal within a wheal along with hepatic candidiasis and be able to describe it with ultrasound terms.